66-year-old Caucasian female presented with gradually increasing protrusion of her right eye over a 1-year period. She complained of increased tearing and foreign body sensation. She denied any change in vision, pain with eye movement, double vision, headache, or weight loss. Her past medical history was significant for hypertension, benign breast lump removal, and skin nodule removal. She had no previous of eye surgery or trauma. Her family history was negative for malignancy or endocrine disorders. Physical examination shows the following picture. So in the case of this case, we're going to say that the diagnosis for this patient is proptosis. All right, we're not going to specify what this might be, but this is proptosis. Unless you have a case that mentions imaging findings, or you mention imaging findings, typically the patient in that case, if there's no imaging, the patient will just come to you with complaints of protrusion in the eyeball, and in that case we'll say proptosis, and that's pretty much it. Unless the case mentions a female patient, let's say, she has proptosis in both of her eyes and she has symptoms of hyperthyroidism or Graves' disease. So weight loss, hot intolerance, for example, basically sweating a lot, يعني hot intolerance بشكل عام, for example, agitated, tachycardia, all the signs of Graves' disease from top to bottom, with protrusion on both eyeballs. And in that case, you can't just say proptosis. There could be a case of exophthalmos or in this case, thyroid eye disease. All right. But in this case, we're going to say proptosis. And the differential diagnosis is many. It could be orbital cellulitis. Now, orbital cellulitis is an infection inside the orbital compartment around the eye from inside. It could be trauma. It could be lacrimal gland tumor. It could be orbital tumor, especially orbital tumors in adults, where the most common extraocular tumor you'll see in adults is cavernous hemangioma. In this one, you'll see a benign tumor lying extraocular within the muscle cone retrobulbar region, and it's well defined, and you will see in an adult that this might be most likely cavernous hemangioma associated with blood vessels. Okay. Besides that, the investigation is exophthalmometer. You'll use a device to measure the degree of the proptosis, how much of the eye is protruding essentially. So you'll do exophthalmometer as well. You'll do exophthalmometer. You'll do CT and MRI to see if there's, like orbital cellulitis, could be abscess or it could be protrusion or it could be anything, a tumor. So you'll do imaging CT, MRI, for example. And in the case of thyroid eye disease, you have to do thyroid function test, TFT, thyroid function test as well. And the treatment is according to the cause, really. If it's thyroid eye disease, you control thyroid eye disease. You give thyroid hormones, and you have to treat thyroid eye disease, the manifestations of thyroid eye disease, accordingly. So the treatment is accordingly. And since we're going to be talking about thyroid eye disease, this is the most common thing you'll see with proptosis. Typically in thyroid eye disease, the patient comes to you with basically lid retraction, all right? So this is with thyroid eye disease. The patient comes with lid retraction, okay? The lid will be retracted back, and this one requires surgery. Another one that can be possibly causing is chemosis, swelling of the conjunctiva, and lid swelling. These two can join together. And this one requires lubricants and non-steroidals, really nothing too serious. Another one is proptosis, and this one we'll start with steroids actually. We're not going to give an anti-thyroid drug for this one. We'll start with corticosteroids topical. If that doesn't work, radiotherapy. If that doesn't work, we can do surgery. So we'll start with topical steroids first for the proptosis. Another one is optic neuropathy, because thyroid eye disease can cause compressive optic neuropathy. It can compress the optic nerve and cause visual defect. And this one, again, this one is typically you treat the cause. So you do all of these, you treat all of these, you treat optic neuropathy. Because otherwise, you might have to do surgery for this one. So optic neuropathy. And the last one is quite important. This is known as restrictive myopathy. Now, restrictive myopathy basically means that in thyroid eye disease, the problem in thyroid eye disease is that some of the autoantibodies, some of the inflammatory cells or the lymphocytes that are attacking the thyroid gland, let's say in Graves' disease, they might migrate to the eye. and they might affect basically the muscles around the eye. They might affect the muscles around the eye and the orbital fat around it. So there's going to be inflammation in the orbital fat in your eyeball as well as the extraocular muscles. With the first muscle being affected is inferior rectus muscle. So you'll have what is known as an elevation defect, or the inability to elevate the globe. So basically these inflammatory cells, these lymphocytes that migrate from the thyroid gland, they can come to the orbit. They can basically affect the extraocular muscles and the fat, causing inflammation. With inflammation comes edema, and with edema over time this can lead to fibrosis, especially in the muscles, and that's why they call it restrictive myopathy. Okay, and that's why there's protrusion, proptosis, because all this accumulation of edema or glycosaminoglycans content, especially around the orbital fat, can cause protrusion of the eyeball forward, and so forth. Okay. So in the case of restriction myopathy, we have to do surgery for this patient. We have to do muscle surgery. And really, general surgery we could do is orbital decompression surgery if we want to especially solve the proptosis in case of surgery. So a lot of these are really common, except for optic neuropathy occurs 5% of the time. But the majority of these can occur 50% of the time. Maybe restrictive, they say 40%, but let's say they're all common. So I wanted to focus on thyroid eye disease. If you have a case of thyroid eye disease in the clinic, you look at all these signs, you treat all of these by an ophthalmologist, and then you do investigation, exophthalmometer, CT, MRI, thyroid function test, and you treat what we mentioned with thyroid eye disease, or with any case of proptosis according to the cause. Okay, it could be a thyroid eye disease, or it could be any of these. Orbital cellulitis, you treat orbital cellulitis. Orbital tumor like cavernous hemangioma, most common extraocular tumor in adults, you treat, and so forth. That's pretty much it.